Well, the Coastal Bend Wellness Foundation could soon have to scale back their HIV and STI screenings due to recent federal funding halts.
The organization provides essential tests and services that are generally free to the public. But with the pause of two crucial grants, they say that they are now in limbo.
Our Josh Maxwell spoke with the Wellness Foundation about the resources that these grants provide, and he's here tonight with a look at what losing funding could mean. Josh?
Mike, the nonprofit relies on two grants, one from the Texas Department of State Health Services, which has been on hold since May 31st, and another from the CDC, which may not be renewed on July 1st. Without those resources, they say they can't keep testing going.
This is going to impact the livelihood of our staff.
Allison Johnson is the Director of Community Health Outreach for the Coastal Bend Wellness Foundation. She says due to federal funding halts caused by the Trump administration's 2026 budget proposal, their office could even potentially see layoffs.
The funding is not there to sustain some of those positions,
which she says could lead to a harmful backlog.
You're going to have a very large burden on the healthcare system because these people are going to become very, very sick and be in the hospital.
Johnson says the lack of funding could turn what is normally a routine process to something people are already having a difficult time scheduling as is.
You're going to have people who just need regular routine screenings having to go to maybe their primary care doctor or the hospital because they just have no other access.
It's a procedure Dr. Nellie Garcia-Blow with Amistad Community Health Clinic says has come a long way since its creation.
It's a very simple blood test now.
Garcia-Blow says that getting regular testing for HIV and other sexually transmitted diseases isn't just something young people should think about.
Me as a geriatrician who's seeing 65 and older, I'm screening clear into their 6th, 7th, 8th decade of life.
But for Johnson, she says the biggest risk could be to public education, meaning limited access to items like
contraception, like condoms, or access to prevention services like a daily prevention medication.
Garcia-Blow says any and everybody should consider screenings, adding that screenings can begin as young as 13 and go all the way to age 65. She adds that while cost is a factor, residents should also be looping in their primary care doctor with any changes to their medical history. Back to you.